How does functional imaging work for CF? Imagine being able to see inside the lungs without surgery or radiation, giving doctors a clearer picture of how cystic fibrosis affects breathing. That's what functional imaging offers. It uses advanced, non-invasive techniques to assess how well the lungs are working, not just how they look. Traditional scans show the structure of the lungs, but functional imaging reveals how air flows through the airways and how blood circulates in the lungs. This helps doctors monitor disease progression and see how treatments are working over time. One of the main tools is magnetic resonance imaging, or MRI. Unlike regular MRI scans that focus on anatomy, morphofunctional MRI combines detailed pictures of lung structures with information about lung function. Some MRI methods use special contrast agents made of gadolinium to visualize blood flow in the lungs. But newer techniques avoid contrast agents altogether, making the process safer and more comfortable, especially for children. These MRI scans can detect issues like bronchiectasis, which is when airways become abnormally widened, or mucus plugging that blocks airflow. They are sensitive enough to track changes from early childhood through adulthood, helping doctors see how the disease evolves, whether during an infection flare-up or in response to medications like antibiotics or CFTR modulators. Another exciting development is oxygen-enhanced MRI. This method measures how well the lungs ventilate by tracking oxygen absorption. It provides a quantitative view of lung function without exposing patients to radiation. This is especially useful for ongoing monitoring, giving a safe way to assess improvements or declines in lung health. Phase contrast X-ray imaging is another technique that offers high-resolution images by capturing differences in how tissues bend or refract light, rather than just how they absorb X-rays. Although mainly used in research and animal studies because of the higher radiation dose, it shows promise for future use in humans. It can evaluate the airway surface liquid layer, which is often reduced in cystic fibrosis and contributes to mucus buildup. Visualizing this layer helps researchers understand how treatments like aerosol therapies might improve mucociliary clearance. While computed tomography scans are still widely used to see detailed lung structures, they primarily show anatomy. The goal with functional imaging is to add physiological information without increasing radiation exposure. Combining these methods allows for a more comprehensive picture of lung health. In clinical practice, functional imaging helps detect lung problems early, even before symptoms appear. It allows doctors to track how the lungs respond to treatments and adjust therapies accordingly. This personalized approach ensures each patient gets the care best suited to their specific needs. Researchers are also working on standardizing imaging protocols and using artificial intelligence to analyze images more accurately, which could make these tools even more reliable in the future. Overall, functional imaging in cystic fibrosis is transforming how we understand and manage the disease. By providing detailed, non-invasive insights into lung function and structure, these techniques help improve early detection, monitor disease progression, and guide treatment decisions. Always remember, these tools are part of a comprehensive care plan, and it's important to discuss any concerns or questions with a healthcare professional to ensure the best possible care.